Jeff Caney here again with a quick case. This is a 66-year-old patient who underwent coronary arterial bypass grafting. And on this chest CT, we see in the upper retrosternal fat, there's this collection or mass here. It's got a pretty dense outer rim, and the inside of it is low attenuation. If we look at lung windows, we can see there's a few tiny pockets of air in there, but most of this is some sort of low attenuation material. Going back to the soft tissues, I'll mag it up so we can see it a little closer. Notice the adjacent fat is pretty happy looking. There's no stranding. We don't see other fluid collections there. And one might think this is a retrosternal abscess, and it very well could look like this. Usually you see a little bit more stranding. I'd expect a little bit more enhancement, a little bit more liquid component in here. But depending on the abscess, where it is in its formation, if it's been treated at all. But it's important to always correlate with the operative nodes. And in this patient, there had been some bleeding, and they put some Gelfoam in the chest right behind the sternum. So this corresponds with that. And this has been reported in the literature, usually in the abdomen. It's not a common location to see Gelfoam in the chest, but I've now seen a couple of these cases. So anytime you suspect something might be a retained surgical body like Gelfoam or some of the other sort of hemostatic things that they use, you can always correlate with your operative note.